If you're a woman in your 40s and you've been told your labs are normal, you're just probably stressed, I want to talk to you. I'm Kevin Davis. I'm a physician assistant in family medicine. I see this every day, every week in my clinic. A woman walks in, she's exhausted, she can't sleep, her mood is all over the place. She's gained some weight, but she can't explain why. Her joints ache, her brain feels like it's running through mud. She's been told it's stress or depression or you're just getting older. And nobody has said the word that explains almost all of it. Perimenopause. That's the story most women go through when they're in their 40s. Never get told. And I want to tell you now. First, let's get this language straight, because the way we talk about this in medicine is genuinely confusing. Menopause is one day, just one day in your life. It's the day when you've hit 12 full months without a period. After that, you're postmenopausal. The average age in the United States is 51. But the part that wrecks women, the hot flashes, the sleep problems, the brain fog, the mood swings, that's not menopause itself. That's perimenopause. Perimenopause is the years that's leading up to that one day. And what surprises most women, it can start in your 30s. It can last 7 to 10 years. Some women even have a rough year and they're done. Some women have a decade of it. So if you're 42 years old and something feels off, but your period is still pretty much regular, that does not mean nothing is not happening. That is exactly when the symptoms start for a lot of women. The hard part is perimenopause, not menopause. That's the part medicine has been slowest to talk about, honestly. Now the symptoms. Everyone knows about hot flashes. Hot flashes are famous. They get all the airtime in commercials and TV shows. And yes, they're real and they can be miserable. But hot flashes are just not always the worst part. For a lot of women, they're not even in the top 3. And here's what I actually see in the clinic. Number 1, sleep disturbances. Women in their 40s who used to sleep like a rock suddenly wake up at 3 a.m. every single night, staring at the ceiling, heart racing for no reason. That's hormonal. Estrogen and progesterone both affect sleep. Brain fog, words you can't find, names you can't remember, the feeling that you've lost a step at work. Women come in worried about early dementia. And what's actually happened is their hormones are shifting. Anxiety, new, out of nowhere anxiety in women who've never experienced it before. Or even old anxiety that comes roaring back, even though life is fine. Joint pain. Estrogen is anti-inflammatory. When it drops, joints hurt. Hips, knees, shoulders, hands. Women get sent to the orthopedic when the problem is their endocrine system. Mood swings. Irritability. Crying for no reason. Feeling like a stranger to yourself. Libido is in the basement. And that's what's frustrating. Most women, when they come in with this list, get screened for depression first and hormones second. Sometimes hormones never come up. I'm not saying depression doesn't exist. It does, absolutely. But if a woman is in her 40 and is 44, her periods are starting to get weird, and she's never had depression in her life, I want you to look at her hormones before I want to write a SSRI prescription. Which brings me to the labs. You go to your doctor, you describe everything I just listed. They draw your blood. The labs come back. Your labs are normal. But here's the problem with that sentence. In perimenopause, your hormones fluctuate wildly, not month to month, but day to day, and sometimes even hour to hour. Your estrogen can be one number on Monday and a completely different number on Thursday. One blood draw is just a snapshot. It is not the movie. It tells you exactly what your hormones were doing in that one moment on that one day. It tells you very little about what they were doing yesterday or what they'll do tomorrow. The problem, the normal reference ranges on where labs are built were built decades ago. They reflect a wild population. They don't always match how an individual woman feels inside her own body. A woman's hormones can technically land in the normal range, and her body can be screaming at her that it's not normal for her. When I tell my patients this, symptoms matter more than the numbers on the lab. The lab is one data point. Your lived experience over the last 6 months is a much bigger data set. Don't let your labs are normal in the conversation. That's where the conversation should start. Now, I want to talk to you about hormone replacement therapy because this is a generation of women who got let down. In 2002, a big study came out called the Women's Health Initiative. The headline said, hormone therapy increases breast cancer. Doctors panicked, patients panicked, prescriptions dropped almost overnight. An entire generation of women either stopped taking hormone therapy cold and never started it in the first place. And this is what the headlines didn't say. The study was done mostly on older women, starting hormones late, many of them in their late 60s or even a decade past menopause. And the form of hormones used in that study isn't the form available today. The studies got generalized. They got applied to every woman of every age. That was wrong. In the years since, we've had more research, and the picture has shifted significantly. For most healthy women under 60, within 10 years of menopause, the benefits of hormone therapy outweigh the risk. That is the current understanding from major menopause societies. They updated their position years ago. A lot of doctors did not update what they tell their patients. Their training was in 2003. Their conversation with you in this room still sounds like it's 2003. I'm not saying hormone therapy is for every woman. It's not. There are real contraindications and real risk, and it's an individual decision. But the blanket fear is outdated. You deserve a real conversation, not a flinch. So what do you actually do? Step 1, start tracking your symptoms. Write them down for 30 days. Sleep, mood, energy, hot flashes, periods, brain fog, joint pain. Date it. Rate the severity from 1 to 10. You want a record, not a memory. And when you walk into that appointment, you can tell your doctor. Step 2, don't accept your labs are normal as the final answer. It's just information. It's not a verdict. What else is going on? Step 3, ask the questions. What are my hormone options? What are my non-hormonal options? What lifestyle changes, sleep, strength training, protein, alcohol actually move the needle for me? Step 4, and this is a big one, find a provider who will have the conversation. If your current doctor brushes you off, that's information. You are allowed to seek a second opinion. You are allowed to look at someone who specializes in midlife women's health. There are more of us than there used to be. You are the patient here. You are allowed to shop. When should you actually pick up the phone and book the appointment? If your symptoms are disrupting your sleep, book it. If your symptoms are affecting your work, your focus, your performance, your confidence, book it. If your symptoms are showing up in your relationship with your spouse, your kids, your friends, book it. If you have symptoms you genuinely cannot explain, book it. If you have a family history that concerns you, breast cancer, heart disease, osteoporosis, book it and bring that history with you. You do not have to wait until it's unbearable. That's the thing a lot of women do. They wait until it's so bad they can't function. You do not have to earn the appointment by suffering enough first. If something feels off, that's enough. This is what I tell every woman who walks into my office with a list of symptoms. You're not crazy. You're not weak. You're not making this up. Your hormones are doing what hormones do at this stage of your life. And you deserve a provider who's going to sit down with you and walk through your options. Instead of dismissing you, instead of handing you a prescription and saying, I'll see you in 3 months. If this video has helped you, hit subscribe. I do this every week. Real talk about midlife health from someone who sees this in the clinic every day. And share this with a friend who are in her 40s. She's probably been told her labs are normal. She probably needs to hear this as well. I'll see you next week.